My name is Dr. Kristen Higgins, and I'm a thoracic radiation oncologist at Winship Cancer Institute of Emory University. So stereotactic radiosurgery is a type of radiation that essentially delivers a high dose of radiation with each treatment to a target that is localized with a 3D coordinate system. Typically, SRS is delivered to smaller tumors. We deliver SRS treatments in the brain. We also do stereotactic approaches in the body, in tumors of the lung, in the adrenal gland, in the bones, in different lymph node regions. There are a multitude of names for stereotactic radiation. You will hear SRS, you may hear SBRT, you also may hear SABR, which stands for stereotactic ablative radiation. And essentially, those are all synonyms for the same type of treatment. Again, it's radiation delivered typically in 1 to 5 treatments with a high dose each treatment to a small target, again, that is localized in 3D space. So we're using different imaging techniques to find the target and make sure that we're able to deliver the radiation with a high degree of precision. Typically for a stage 1 lung cancer patient, they'll visit with a surgeon to determine if they're a candidate for surgery. Now, in the event that they're not a candidate for surgery, whether it's because they have damaged lungs or a heart that doesn't work properly, or they're too high risk for anesthesia, for whatever reason, if the surgeon feels like the potential side effects from surgery are too high, they may be referred to a radiation oncologist for non-operative treatment. And in that scenario, we will deliver SBRT, typically between 3 to 5 treatments to the tumor. And we typically do this in a 1 to 2 week radiation course. The side effects are very mild. Patients tolerate the treatment very well, and the efficacy of the treatment is quite good. There are trials right now that are comparing the efficacy of SBRT and surgery in patients that are operable. There's one that's ongoing right now within the Veterans Administration system. So we look forward to seeing the results of that. But I do think that SBRT is a great option for patients that are higher risk for surgery, or even for a patient that really doesn't want surgery and feels more comfortable with non-operative approaches.